On behalf of Governor Holcomb and myself, we want to officially welcome you to Indianapolis, and it's an honor for Indianapolis and Indiana to host this first ever conference and have it take place here. And how interesting, intersection of technology and health taking place at the crossroads of America. I was in Washington, D.C. About a month ago visiting other lieutenant governors, and I was so impressed that everybody was coming to me saying, "What's going on in Indiana? How are you making things so good?" And I will tell you why I know they were asking me that and saying that, because Indiana leads the country in advanced manufacturing. Indiana is #1 in the cost of doing business, in small business growth, in highway accessibility. Indiana is #2 in our regulatory climate. We're #3 in the cost of living. We're one of only 12 states that have a AAA credit bond rating, and our unemployment is consistently below the national average. But you know something else? We're just getting started. Governor Holcomb and I have 5 pillars of our agenda, legislative agenda. And one of our first pillars is to continue to make Indiana a jobs magnet and to strengthen our economy. And while that's important, we also have 4 other pillars that are as important. Upgrading and modernizing our infrastructure, because infrastructure drives economic development. Strengthening our workforce by creating a 21st century workforce that's ready for those skilled jobs that are out there and bridge that skills gap. We want to, in addition, relentlessly fight the drug epidemic that is ravaging not just our state, but our entire country. And we'll talk about that a little more later. And then, of course, in Indiana, we always want to deliver good government at a great taxpayer value. So, welcome, and I want you to know that we will be walking alongside you. We're excited about this new era of innovation that you are exploring and refining right here, right now. And I'm proud to say that Indiana's healthcare industry generates almost 250,000 jobs and employs 100,000 healthcare professionals. Indiana hospitals generate $2.5 billion annually for local economies just in capital spending alone. And Indianapolis and Indiana are gaining the reputation in the technology sector. Forbes ranks Indianapolis one of the nation's top 10 fastest growing tech communities. And Fast Companies rank Indianapolis one of the top 10 cities in the United States for technology jobs. So Indiana is kind of become known as Midwest Silicon Valley. It's a home to a vibrant community that is always innovating. And as innovators, we have to mention our life sciences sector. When people think of life sciences in Indiana, they think of Eli Lilly. Indiana is ranked 5th in the country for our drug and pharmaceutical employment. Indiana is also known as the orthopedics capital of the world, and we are home to the world's largest private medical device manufacturer. In terms of manufacturing output, and remember I shared with you that Indiana leads the nation in advanced manufacturing, our life science companies in Indiana outpace the auto industry. And Indiana's life science exports are $10 billion, the second highest in the United States. And those exports account for 1/3 of all of Indiana's exports. Breakthrough research, exceptional scientists, visionary leaders, world-class organization, and life-saving products add up to an economic impact of $60 billion annually. And for us to be successful, for you to be successful, we have to collaborate. And an example of that collaboration is the founding of the Indiana Biosciences Research Institute, addressing the need for better health solutions in the local and global community. By building on existing industry and academic expertise, the Indiana Biosciences Research Institute will deliver important answers to metabolic disease, including diabetes, cardiovascular disease, and obesity, to improve health outcomes and economic impacts of these global epidemics. While Governor Holcomb and I take great pride in what has been accomplished in Indiana, we know we can't rest on our laurels. We must continue to challenge and dare ourselves to create a better tomorrow for future generations, a tomorrow that produces even greater opportunities than we ourselves could realize. And as Hoosiers, we know we need to continue to live up to the 5 pillars that frame our legislative agenda. So in order to take our economy, our state, and our country to the next level, we must defeat the drug epidemic. In 2015, I traveled to all 92 counties in Indiana, and when I was traveling in the rural communities, I was devastated to hear the stories of babies born to mothers addicted to drugs. And in fact, in one hospital here in Indiana, 1 out of 4 babies were born to addicted mothers. And our overdose deaths are skyrocketing at a staggering rate. So there are things we can do and things we must do. This session, we passed a bill. We're waiting to sign it into law that gives local officials greater control over the needle exchange program in order to better meet the needs of their communities. This epidemic will require all of us to work together. So thank you for tackling that issue and many others in your conference, and I'm excited to hear what you come up with. So in closing, I want to thank you for choosing our great state for your conference, and to remind you that is what is great about our great state, what is great about America, what is great about the world are her people. Those of you in this room today, Hoosiers, Americans, people all over the world that know that government, that know that corporations aren't the answer, but rather we are. So thank you, have a great, great conference and a very great weekend in this beautiful, beautiful capital of Indiana. Thank you very much.